Thank you for joining today's show. There are more than 2 lakh children born in India every year with congenital heart diseases. And there are less than 100 pediatric cardiac surgeons in the country who, at some point of time, will see these babies and treat them. Today, we are joined by Dr. Prashant Shah, one of the leading pediatric cardiac surgeons in our country. Dr. Prashant Shah has operated more than 6,000 children with complex pediatric cardiac problems over last 20 years. These children come from across the world, more than 20 countries. We are so glad that Dr. Prashant Shah could join us today on this show to share his insights, his experience, and burst some of the myths that people and parents might have related to pediatric cardiac problem. Heartiest welcome, sir, to the show.
Thank you, Govind, and I really appreciate today for your invitation for today's podcast.
Thank you so much, sir. We are so glad to have you. So, my first question to you is, who is a pediatric cardiac surgeon? What it takes to become one, and how is it different from the other cardiac surgeons that we see and whom we visit when any cardiac problem arises in the family?
So, pediatric cardiac surgeon is basically a trained cardiac surgeon. So, if you go into the history of cardiac surgery, the first pediatric cardiac surgery happened in 1958. So, with the history of that first cardiac surgery, the cardiac surgery has evolved in so many different complex surgeries in technologies, and the results also improved as we got more experience into it. So initial training time, it was only one specialty, it was called cardiac surgery. There was no separate adult cardiac surgery and pediatric cardiac surgery. But as the demand increases, as the complexity work is increased, there is a demand of a specialized department called pediatric cardiac surgeon, because the focus of pediatric cardiac surgeon is completely different than the adult cardiac surgery. The skill set required, anatomy and physiology understanding required is completely different than adult cardiac surgery. So if we talk about India, since 10 years, pediatric cardiac surgery comes as a separate subspecialty of cardiac surgery. When I have taken my training in 2001, on that time there was not much demarcation between adult cardiac surgery and pediatric cardiac surgery. But on my during training time, I realized that worldwide it is separated, and in India it is starting separating. And that's why I thought I should more focus on pediatric cardiac surgery. I can say it's a congenital cardiac surgery. So pediatric cardiac surgery we are talking because of the spectrum of the disease, but it is ultimately a birth defect. It's called congenital cardiac surgery. So then I have decision for my congenital cardiac surgery become completely, I can say that this is the future, because you cannot do adult cardiac surgery and congenital cardiac surgery together. And that's why I choose that branch, and this is the pediatric cardiac surgery.
Right. You mentioned about pediatric cardiac being very complex. So, if you could share that, how is that child's heart different from an adult heart? As a layman, I would understand that yes, a child heart weighs around maybe 50 grams or 100 grams, whereas an adult heart would weigh maybe 250 or 350 grams. But apart from that, as a surgeon, what are the differences you see in terms of development, in terms of functioning, or any other aspect?
So if we simply say heart is nothing but is a pump. And in development aspect, if you see at 3 months of age, all organogenesis happens. So when the heart beats first time, it is like 18 weeks or 3 months. And on that time, if any defect means during the formation of the heart, if any defects happen during the formation, so that is called congenital heart defect. So the children who are born with this kind of defect is called children with the heart problem. While adult problems are acquired problem. That is basically because of the lifestyle or because of the infection or because of immunological problems in the body. But congenital means pediatric heart problems are always, it is a birth defect. As you mentioned, it is a basically heart is like a fist. So if you put your fist and put your all over the chest on the left side, then you will realize that the heart in children will be very, very small. So in congenital heart disease, sometimes we operate in neonates, which is like less than 30 days, and their weight will be hardly around 2 kilos or 3 kilos. Their heart is really, really tiny. And when we want to operate these children, we have to first stop the heart and then defect, we have to repair it. So that is because of the size of the heart and because of the physiology of the children, because the small babies, the chance of infection is high in the post-op. Then second thing is in cardiopulmonary bypass, we'll talk in later in detail. The body behaves very differently in children than the adult. So all this, first is size of the heart, because second thing is complexity of the problem in the heart, and third is physiologically disadvantage because of children. This all makes pediatric cardiac surgery very complex.
Got it. Sir, if you could, further share, let's say you mentioned about at 3 months, people will be able to come to know that, yes, there is some defect in the heart through some scans or something. Is there any other way or any other window in which, to be parents can come to know that, yes, there is a potential challenge with the heart? And one, if they have missed that, as a fetus, they have missed it, then what are the early signs when a baby is born, which will indicate that baby is having some heart issues?
So when child born, the neonatologist comes and do the thorough examinations. And the first most important aspect is oxygen saturation. It's called pulse oximetry. Very simple test. Only one simple test. If you check the oxygen level on the upper limb and lower limb, and if it is normal, if it is more than 96%, then there is no problem that child has any issues. It can be a cyanotic heart disease, but the main complex defect which we see in neonate has been ruled out with only one simple test. So, second thing, as you mentioned, we can identify the defect during the fetal age itself. It's called fetal echocardiography. And the specialized pediatric cardiologist who is specialized in fetal echocardiography can do a special test at the 6 week of age, and we can find out any defect is there. There are certain times the defect is not completely defined, but they give the indication that okay, this child may have a congenital defect, so you have to evaluate and do echo immediately after the birth. So these are the important things parents should understand. The, each and every pregnancy doesn't require fetal scan, but there are certain high risk pregnancy, like when the mother is having any kind of viral infection or diabetes or she's a smoker or elderly parents or the parents who has first child has a congenital problem and second child. So all these uh, parents has to think about fetal echo scan in their pregnancy.
Got it. So let's say they missed out and, after birth, a doctor says that your child has, a heart problem. So what are those 4 to 5 most common heart problems that you see frequently in children with cardiac issues?
So as I explained previously, our heart is very complex. In our pictures, we see the heart like just like you can put like this, and it shows that heart. But our heart is a most complex structure along with the brain in the body. So it has a mainly two pumps. It is not only single pump. It's a two pump, right-sided pump and left-sided pump. So any defect, including bringing the blood to the heart to going to outside the heart, there are a lot of problem can happen during the organogenesis. So it can have a simple hole in upper two chamber is called atrial septal defect. Second is simple hole in the lower two chamber is called ventricular septal defect called VSD. The commonest defect is VSD. Second thing is ASD, atrial septal defect is a second commonest defect. Third commonest defect is a combinations, like a child has a hole in the heart as well as there is a narrowing in the lung artery also. So that is called tetralogy of Fallot, 4 defects in the heart. So the TOF, tetralogy of Fallot, that is the third commonest defect. After that, we have so many defects like a patent ductal arteriosus. It is an abnormal connection between the lung artery and the aorta, which is normally present in every fetus. And as during the delivery, this close it immediately. So the PDA, patent ductus arteriosus, is the fourth most common defect you will see. And after that, you have a narrowing of the valves, leakage of the valves. There is abnormal connections of the lung artery and body artery, abnormal connections of the lung veins, which is called pulmonary veins, and stenosis of the aorta, which is called coarctation of aorta, isolated stenosis of the lung artery, which is called pulmonary stenosis or infant blood. So there are a lot of combinations are there in the congenital heart disease. It can be a single effect or it can be a multiple effect. Along with that, you can see the position of the heart, because normally you see the heart is on the left side. So there are certain children which has a heart on the right side with a combinations of multiple defects, and certain children has a heart in the center of the chest with a completely reverse phenomena also, and certain children has only one pump. Normally, as I told, it's a right pump and left pump, but they have only one pump. So there are multiple combinations can be possible, but the most common is the ventricular septal defect, atrial septal defect called ASD, tetralogy of Fallot, TOF. These are the most common defects.
Right. And sir, if you can, I know each of these conditions are very different, but is there a broad outline of the treatment? As in, what is the journey of the patient from the discovery that the child has a heart problem uh, till, let's say, some of these patients reach you? What could be a few journey path for the patient and their parents?
So basically, the presentation of children happens depending upon the type of the defect in the heart and any associated defect. So as I mentioned earlier, that less than 30 days old children, they have a normally the abnormal connections of aorta and the pulmonary arteries called transposition of great artery. They present very early. While there are certain hole in upper two chamber called ASD, they present very late. And depending upon their defect, the type of surgeries, timing of the surgeries, and the long-term outcome of the surgeries defines. So I cannot give only single statement that the journey goes like this. But one statement I can tell you is, if we can diagnose the congenital heart defect as a right time, we perform the surgery at the right time, 90% children become a normal. When I talk about normal, it's normal means they lead their life normally. They can take even sports as their career. That kind of normality comes into the life. But there are 10% of children may require multiple surgeries, require long-term follow-up, and all these aspects. So it mainly depends upon the type of the defect and timing of the presentation.
And sir, what goes in your mind when a child comes to you with a heart condition?
Yes, sir. So for this question, I would like to divide into the two. When I have started my early career, when I was dealing with the parents. So along with the parents, I realized that it is a really big trauma for the father and mother, mainly the mother, because they are young. They have not seen their life. They get a lot of expectation for their first pregnancy. And when they understood that the child they got has a heart problem, and in our society, heart problem means it's a big problem. So they always think about life and death. So the first thing, they actually broke out. They'll cry, and then they come with a lot of patience that with what will happen to me. So it's really a big trauma initial career. I also felt very bad for the parents. But then I realized slowly that if they identified early and that they take it positively, these children anyway is going to become normal children. So I always started giving a lot of hope and support them emotionally and tell them that take this whole thing as a positive aspect. Think that okay, you are identified at the right age and you go ahead without any doubt. with a very positive mind with the treatment, and your child become a completely normal child. That I assure. So this is the main thing is you have to connect with the parents, you have to talk to them and give them a confidence that okay, whatever happens, it is not in our hand because it is a birth defect. It is not at all a fault of parents. Because sometimes the parents comes with the doubt that okay, maybe I had made some mistake or my family genetically we have a this thing and I married a wrong wife. This a lot of complexity comes along with this emotion also. So then I have to literally tell them that no, this is not your fault at all. It is a birth defect and God has given this problem. But don't worry about it. We are there to cure and the whole journey we are there with you. And that makes the lot of confidence to the parents.
As a surgeon, how do you strike balance between giving hope to the parents and calling out the risks associated with the procedure that the child will undergo?
Yes. So when we talk first thing we have to tell them that your child has a defect. So we normally explain in detail about the normal circulations and then we explain them about the defect. And if we don't do anything, what will happen? That will explain and then we will explain the after the surgery what are the things. So when I have to explain the risk to the parents because today every parents comes with the Google. They have a lot of information about the defects. So just to make them happy, I cannot just bluntly say that everything is going to be a right because today's world it's an information world. So I will explain them scientifically that the complexity of the defect is this and the risk of the defect is this. And when I talk about the risk, I'll divide the risk also into the multiple level, like the risk of the life is this much, risk of the ICU and ventilator stay is this much, and the long term outcome of the recurrent surgeries and this kind of risk also is this much. So because of the scientific data backup, because of our experience of more than 6,000 internet era and education of the parents, it's very easy nowadays to explain to the parents.
Sir, can you call out, the few most common risks that you explain or you encounter, whether it be, there's of course the risk we are running of not doing anything. I think that's the biggest risk. But apart from that, pre-procedure, during the procedure, and during, let's say, immediately after recovery and sometime after recovery, if we divide in those phases, what are the most common risks that you encounter? And any particular tips or advice for the parents in order to mitigate some of the risks which might be more external?
So as the risk again depends upon the type of defects which we are operating and the age of the child and the weight of the child. So this too is very, very important to understand that as the child is small and the weight of the child is very, very small, the risk is always high. And there is certain complex defects. The example is a transposition of great arteries or where it's called all the aorta, body artery and lung artery are reversed or certain conditions where there is a single ventricle, multiple complex defects, the risk is more. So on that time, there are immediate risk is there during the surgery. So when I talk about the immediate risk, because when we do the cardiac surgery, we normally change the physiology also because now the child is adopted with one circulation. When child born with the abnormal circulation, but the body is adopted with that circulation. Now we are making it normal. So for us it is normal, but for body of the child it is abnormal. So the body has to adapt this new circulation, and that new circulation adaptation require longer time in small babies than the bigger children. So during the surgery, like when we want to do the surgery is happening only on cardiopulmonary bypass, where we take out all the blood from the body. The lung is artificial lung and the artificial heart take care of the heart and lung work. So on that time, a child heart and lung is completely stopped. We open it, we correct everything, and then slowly we put back all the blood inside, and slowly the lung also will start. So the whole process is called cardiopulmonary bypass. So cardiopulmonary bypass is a safer procedure, but the effect depends upon the child age and the weight. So When we completely correct it and when we try to put this blood back to the heart has to function normal like before. And in children, small children, sometimes it takes a lot of time or sometimes it doesn't work. So in that situation, we have to put the patient on the longer bypass, and the chance of losing the baby also is there in a very complex defect. Second complication we normally see is in the ICU. Once you do complete correction, we shift the patient to the ICU. Children will be on the ventilator where there is a tube in the throat that and the machine will work as an artificial respiration. So it is called ventilator. And once patient recovers slowly, we have to remove the ventilator. So sometimes child require lot of days to recover, and sometimes because of this they get the lung infection, the lung pressure goes up, and get a lot of other body infections, multi-organ failure, and then patient succumb in the ICU. So these are the most common heart surgery related complications you see. So the when we talk about the risk of the parents, then first risk is a risk to life. Second risk is the longer ICU stay, because as the child stay more on the ventilator, ICU will be prolonged. And the third is the infection, because small baby immunity is low, and you have multiple lines for the measurement of the arterial blood pressure, central venous blood pressure. So invasive lines, then the drains, then catheters, all these things makes the child prone for infection. So any additional infection can also cause the problem with the. So these are the commonest complication you will see in the ICU and the cardiac surgery.
And sir, from parents' perspective, let's say they know that their child is going to undergo a pediatric cardiac surgery. So in terms of preparation from the parent side, are there anything which most important things parents can prepare, like let's say diet for the child before surgery or anything else in that regard?
So when parents decide about the date of the surgery, the first thing is child should not have any infection. So they should avoid traveling to any crowded area, like they should not go in a common transportation system or in a crowded area like a temple, church, or mosque. They should not bring the children to that crowded area because they will catch infection. Second thing is they should, mother or father should keep a hand hygiene. Hygiene is very, very important at home. So these are the main factor that child should not get a single infection before surgery. So if infection is there, you cannot proceed for surgery. Number two is the emotional aspect. So mentally, the father mother should prepare themselves, because if they are mentally strong, we have seen in certain cases that even the high risk patient, if mother is strong and very positive, the results of the surgery is very good, excellent results. So, and the same thing we have noticed that if mother is very labile and she is not emotionally strong, then we see a lot of complications. So we don't know scientifically, but there is a lot of connections of that positive mindset of the parents and the outcome. So second advice for parents is be positive always for your child surgeries and the outcome. And third thing, it is very important because nowadays the cost of the surgery and everything is going up and up, and doctors or the team cannot predict the ICU stay. So they have to be prepared financially also, along with emotional, because that also gives a lot of stress to the parents after the surgery. Because once surgery is over, they already knows about this, and then they get a long bill that okay, child has a longer ICU stays, and you have to pay this much amount and all. That gives additional stress that how to arrange this money and all. So if they mentally prepare for financially also, they should be very comfortable during the whole process. And fourth point, I should ask the parents that keep some social support with you, because as a father mother, they are young, they have not seen their life. So either in the form of their friends or the form of the family members, that social support helps in a longer way. So these are the 4 points which is very important before surgery, because once they admit the child in the surgery, clinical team will take care of everything. They have to just relax and give a whatever is required. Clinical team will talk to them, and their work is done.
You mentioned very interesting point that although no research or scientific evidence is there, but a positivity of parents, particularly mother, can help in positive outcome. Can you share any particular anecdote where you personally found the mother very inspiring and which in way contributed to positive outcome for the child?
Yeah, when you talk about this example, I have a couple of examples, but today I'll talk to one example. It's a 14-year-old girl which had already undergone 2 cardiac surgeries in some other hospitals, and that is a single ventricle. There is a Fontan circuit, we can say, where they have put one tube graft, and that is completely blocked off, and the child was vomiting blood every day. And child was in very sick condition, and because of the complexity, somebody has referred the parents to us. After seeing the condition of the child, first thing I talked to the mother and told it's going to be a very high risk, and we are ready to take the risk. But if you are giving me a consent about the high risk, then I'll proceed, because we don't have any other options but to go ahead and do the surgery. So mother told me that, doctor, don't worry, my child is going to be all. So this is the things where gives me a lot of confidence. Okay, if mother is telling like this, next day I performed the surgery, and on second day child was doing well. So this is a really emotional, that whenever I think about that, I also become so emotional. So this is the branch where you deal daily with the mother and emotions. And that is why I always tell that if mother is strong, if mother is positive, the results of the surgery is tremendous. Because surgeon can do the cut suture, but the ultimate physiology and healing is something higher power does. And no science, we can say a lot of science here. We can do scientifically everything, whatever is mentioned in the book. But there is certain things beyond the science which I believe it exists.
Sir, hearing this anecdote, I was getting goosebumps, and I could link it to, manifestation. Because if you really manifest and you desire for something to happen, the words you speak, the actions you take, somewhere the nature will conspire to make it happen for you. So thank you for sharing that anecdote. On the same note, I'm sure, a lot of times because of raw emotions that young parents will have, they might also give the surgical team or the clinical team very tough time. So how do your team and you as a surgeon manage that? And what are certain checks that you have placed for yourself and your team so that it does not impact the outcome of the surgery when you're going inside the OT or inside the IC?
So this is a very important aspect. Everybody as a clinical team also has to learn is talking and communication with the parents. In each and every stage, we have to do it, and that is what we have made from first consultation to the surgery, before surgery, during the surgery. Every stage, as a surgeon, I myself will talk to the parents. And we have made a protocol even in the ICU that when child comes back from the operation theater, parent should be informed completely, and that should be a written thing should be there that parents has understood the condition of the child, and the risk and everything is involved. So the process what we follow because of our experience is very thorough, where they parents are involved in each and every stage of the treatment, and they are informed. And in our ICU, we have make a open ICU system for the mothers. We know that ICU means the parents are not allowed, only the doctors and team will be there. But I understood that the outcome is better with the presence of mother, and that's why in my ICU, I've made a policy of allowing the mother with proper sterile precautions with the gown, cap, and everything whenever mother requires. So that gives a lot of confidence to the parents. After the ventilator is removed, when child is awake and when child sees a familiar face and mainly mother, the recovery of the children also improves. Yes, as some of the earlier career, I have faced some of the problem also. There are one example is like in whole process, we lost the child and there was a denial from the parents. They were not even agreed upon that child is expired. and they were not ready even to come and see the condition of the child, and they are not able to even talk to the doctors. They were only telling that my child cannot die at all. So that kind of emotional breakdown or denial stage can come to some of the, and that is a maybe a natural, and maybe some of the time parents are not emotionally strong. So this kind of situation we normally face. But in the opposite side, I have seen in some of the other country also that we have done our best and we lost the child. The parents comes, thanks the complete team and say that doctor, you have done the excellent job, and whatever happened is we have to accept it. So we have seen both kind of scenarios, but nowadays because of the information, because of communication, the parents are really cooperating, and they understood the risk and all. So we are not facing that many problem in pediatric cardiac surgery like other kind of surgeries.
Sir, you are a pediatric cardiac surgeon, but end of day, you are also a human being with a heart. So, how do you deal with the emotion of losses, and also how do you approach the wins in your day to day life as a surgeon?
This is a journey which we have to start along with our career, and this is a along with the surgical journey, you grow the spiritually also. I've met a lot of my friends across India as well as abroad. The way pediatric cardiac surgeon grows spiritually also is very tremendously. They progress into that field. So this maturity is very important to deal with any success and the failure. So when you take the success in a bigger way, then always you will have a problem dealing with the failure. So if I can tell about myself, I always feel that whatever we are doing it, we just are doing our work, and somebody else is performing this through ourselves. So that makes me more humble, and any surgeries which is complex surgery when patient goes home, I don't take too much happiness or only that I have done surgery, that kind of stuff. The same way when I lose the child, I always feel that I have given my best. I always introspect myself and think that have I done something wrong, and because of my mistake child has got a problem, and I have to improve myself in future for this kind of surgeries. So I'll take some lesson out of that, and I'll become more strong and more positive with that example. So keeping the balance of success and failure is very, very important for pediatric cardiac surgery. Otherwise, you cannot deal with complex defects in a longer run.
So, you mentioned about X factor. Any particular case or anecdote you would like to share where that conviction that yes, there is an X factor playing out, you could experience it?
Yes, this is a very important one. We can say normally it's like a miracle. Have you seen? So I've seen a couple of miracle happening. When I talk about miracle, which we cannot define with the science, and that's why we say that miracle. So I am talking about 2010 when I have done one very complex surgery. I don't want to tell the name of the child. After the surgery, we have shifted the child, and in the ICU, child's heart stopped, and we have to immediately open the chest and we have to massage to pump the heart. Normally, if you massage for a couple of minutes, the child heart becomes normal, and then you do other medications and make sure child recovers slowly. But this unfortunate child, for that time, you tried massaging, but child was heart was not pumping properly, and I have to continuously massage for 45 minutes, which is a really really longer time than regular standards. So I told our team, because it is in ICU, my intensivist was there, our anesthetist was there. We thought that we are losing this battle. Let us call the parents and tell them that we may have to stop this massage, and child may not make it. We have called the parents, and we have informed that maybe there are only 1% chance that child can survive, and if that is there, we will try 5 more minutes. And so when they came to the ICU, we spoke to the parents that only 1% chance, and I don't think that child is going to make it. And we are, after 2 minutes, we are about to tell them that we are stopping, and suddenly my intensivist told me that please wait. Start. This child heart has started beating slowly, and let us do it. So we have given a lot of medications, and with our surprise, this heart has started really beating slowly, slowly, become moderate, good function. And then we have kept the chest open for 48 hours. And at 48 hours, we have closed the chest, removed the ventilator at the fourth day, and we have discharged the child. So when we discharge the child, we have given this name as a miracle baby. And today, this child is coming for follow-up every year, and child is into the sixth standard, completely normal. So there is always, I feel that something beyond science is there which works, and that is why I always tell that positivity of parents. And all these things, why I'm telling you now is because when I'm talking to the father mother, when I'm declaring the baby, and because of that positiveness, something I don't know what, it is not, we cannot explain this in science. But today, the child is coming for follow up, it itself showing that there is something beyond science and surgery and all this there. So I always, and this is not only one example, there is one more example where mother is a teacher and she herself will believe that this is the miracle. So when you have a longer career, you will see any, and not only me, I can say any pediatric cardiac surgeon across the world must have seen this kind of miracle in their life. So there is always beyond the science, there is some energy who helps us.
Sir, you had a very long career, 2 decades, and there would have been some child. You mentioned about this child, now in class six, but there would have been another child, maybe whom you operated when the child was very small, maybe few months, but now would have become adult. So, any such, anecdote you can share with us? How did the child's life unfold?
Yeah, here I'll give you one example, and that is one child in down south of Tamil Nadu. It's basically Weaver's place. It's called Rasipuram, where one child has a very complex defect, and they went to any big corporate. I don't want to name, and every place they told that this child is not going to make it, and so please don't proceed for the surgery. We had one camp with the Rotary Club, and somehow that child came to see me. It was my early career, and I always took a lot of challenges on that time. I just explained to the parents that okay, I am ready to do the surgery, and it is a multiple stage surgery, may require 3 surgeries on the child. They agreed upon. You perform first surgery, went successful, second and third. On completion of the third surgery, child become completely normal child, and now the child is grown up, is completed his college, he's working in some of the industry, and he's playing the cricket. He's a bowler, fast bowler. He always comes every year and always prays his gratitude towards us. And not only him, the whole village has celebrated this success in a very big way. So, if you lose the hope, there is 100% failure. So, always keep a hope because hope is a life. So, keep hope, keep thinking about that, okay, somewhere you will get the help, and with that help, your child become a normal also. So this is the most important thing. Every parent should think that okay, just keep hope and go scientifically whatever is possible for your child.
So we hope that you will continue this work and touch the lives of so many others who come under your care. So a few last questions. In your earlier career, I found that you were working with certain hospitals, but for past many years, you are trying to build your own team. You have a very successful team operating multiple places across the world, and the motto for your team is quality care at affordable price. So what does this mean to you, and what is that parent should understand from this statement, from this mission?
Yes. Basically, the pediatric cardiac surgery, as I told, it's a very complex surgery, and the cost involved in this surgery is also very high. And if you see the demographically, and the developing country has more problem, not only because the number of patients are more, because the infrastructure in government side is less. So the burden to the parents are more for these children. The cost of the surgery, this kind of surgery in the private sector, I can say corporate sector, is very high. In my early career, I worked in corporates where, as a surgeon, I don't have any say about the bill. And when child stay in ICU for couple of days, whatever good thing you have done it, the bill kills the all hope of the parents, because it every day it piles up, piles up, piles up. So they are not thinking about the progress of the children, but they always think about how I will pay this bill to the hospital. And that's where I realize that the person who deals with uh, directly the parents is me. I have to do something to sort this problem out. Because if you tell parents that you have to keep certain amount ready for surgery and then it builds up the bill, they cannot do anything. So the concept which we built in is a one fixed cost. If I say the parents X cost, if child stay in ICU for 10 days or 15 days, whatever cost I incur in my hospital, we normally don't charge anything to the parents. So they are very happy with this kind of model. Because they have already prepared that X cost and they are not going to pay anything. They are now thinking only about the treatment and progress of the children. So that leads to affordability, because these parents who are collecting the money and doing the treatment, they can afford this cost to our hospital, which is a fixed cost. Second thing, we are not investing too much into the infrastructure of the building. We are mainly investing into the core parts, like operation theaters and ICU, which is a core part for the treatment. So we are not much focused on how our patient rooms are and how the hospital will look, because definitely if you invest more money, you require more return. So our main focus was the treatment and the outcome. And because of this focus, my investment cost also has come down. I've invested heavily into the ICU and operation theater. Our operation theater and ICU is excellent, one of the top level. But if I will, hospitals is a small scale hospital. Cost is reduced, and that is giving benefit to the package of the patients. So when we give the package, they are really amazed that how can you do pediatric cardiac surgery in the cost. So that is only because we have cut down the cost in the rooms and other infrastructure. We have mainly focused on our core, which is operation theater in ICU. And that makes the treatment most affordable. We have created the special package for our Indian children, special package for some of the developing countries like Bangladesh, Uganda, in some of the African countries, in Nigeria. And we have treated patients from more than 20 countries. And because of this model, they are very happy. And third most important point is we have removed that intermediator factor also, because sometimes the person who is bringing the patient to the hospital, they will have his component also into the treatment cost, which we thought that this should be directly passed on to the parents, and that has also reduced the cost. So the best treatment we are providing is the most affordable cost, because of our model of hospital and our model of working and our mission to treat every children who comes to us should not go back without the treatment.
I think very noble cause, and that rightly reflects in the mission statement of your hospital. And what you just said resonates so much. So it's not just about giving the right treatment, but treating at the right cost also, so that it becomes affordable, and patient family can focus on the recovery of the child. Sir, any final to our listeners, our parents, young parents who have a child with heart problem, if you could speak to them, any final message or words you would like to have for them?
So, dear parents, I am concluding today's talk by saying only one thing: keep always positive mind thought. Never delay the surgery because you are fear of the surgeries, and never get shortcuts because nowadays you have a lot of technology. Without doing the surgery by the device, you will go and meet different cardiologists. Take opinion of cardiac surgeon as well as cardiologist. Don't go with only cardiologist or only surgeons and take the final decision. And third thing is, don't do Google, because Google gives you from base to everything. We spend the whole career for this study. And Google, with one sentence, your stress level will increase and you will be more confused. So whenever you have any questions, please discuss frankly with your cardiologists or cardiac surgeons. Choose your team wisely and don't delay the cardiac surgeries. Thinking that this defect will close automatically, you will delay the procedure, you will increase the risk, and your child will become not normal. It can cause a lot of problem in future also. So with this, I can end my talk, and I wish you all the best for your children with the heart defects.
Thank you so much, sir. It was pleasure having you on the show. Thank you again for your time.
Thank you, Govind, for calling me, and all the best for you.
Thank you.